In this video, continuation of ANS drugs, second chapter, anticholinergic drugs. The same way we will study. Learn the classification. First here the prototype drugs is atropine. So these are the drugs comes under this category. Anticholinergic drugs. Next, mechanism of action. What does it do? It block only. Okay, this one block only muscarinic receptor. Don't block this nicotinic receptor. Only this drug block the muscarinic receptor, not blocking this nicotinic receptor. These drugs, okay, atropine. The drugs block muscarinic receptor, not in nicotinic receptor. What will happen? Acetylcholine cannot act on it, so it will block this muscarinic receptor, means this acetylcholine not bind. So what does acetylcholine? Acetylcholine, this M1, M2, M3. So do all these at muscarinic receptor. So M1 their action, M2 their action, M3 and their action. M1 and M2 and M3 this action, this is not done because acetylcholine cannot bind. If acetylcholine was binding here, all these tables, all the things takes place. Now this receptor is blacked, so all the reaction is blacked, not happen. So now this receptor blacked. Can you see these red color drugs? These drugs is atropine. Atropine is blacker. Atropine is a blacker. It is just blocking the muscarinic M1, M2, M3. So acetylcholine cannot bind here. So here it cannot bind. So if acetylcholine was binding, it was showing that action. Now acetylcholine was not binding, so it will opposite that will happen. For example, and now if heart, the acetylcholine is binding at the heart, means it reduce that heart rate, it reduce that contraction, it reduce that velocity. But now that acetylcholine was not binding because it blacked it, so it will increases that heart rate, increases velocity and increases that concentration. Like that, if that organ in gland, any organ, salivary, any organ, if acetylcholine is coming and binding with the gland, it increases that secretion of the gland. But it is not binding now because it is blocked, so it will reduce that secretion. That is anticholinergic drugs. So next uses here, 7 uses and 2 side effect are there. Here everything is opposite. So whenever bradycardia is there, these drugs increasing that heart rate. So these drugs increasing heart rate, atropine increases that heart rate. Normally acetylcholine reduce the heart rate. This atropine black acetylcholine so increases the heart rate. It will also reverse. So if that patient is having bradycardia, give atropine, it increases that heart rate. First use is heart rate, second one is diarrhea. If that patient is having diarrhea, what does it do? It decreases that contraction, it relieve the diarrhea. So in GIT the uses diarrhea. Then urinary anuresis. What is urinary anuresis? Passing urine in the bed, especially children. So urinary retention opposite. So urine anuresis we can cure this tablet. Then ice mitriasis, that one is miasis, this one is mitriasis. Then gland, used in gland, in the gland the person having excessive nasal secretion, we can use this one. Then also we can use the Coryza and free anesthetic medication also we can use Coryza and free anesthetic medication. In central nervous system, it is used in motion sickness and Parkinsonism. Motion sickness because it depresses basal ganglion that's used in Parkinsonism, and it depresses the vestibular center. So that why given in motion sickness, whenever we are traveling the person having vomiting, that is used in motion sickness. Then physiological antidote. So these are the uses. Next, contraindication. There are two side effects. So contraindication, it is releases ciliary muscles, it increases IOT. So it never given in glaucoma, never given in glaucoma. Then this never give PHP. What is PHP? Benign prostatic hyperplasia. What is PHP? In male, see this diagram. Male, there is a gland. Can you see the prostate gland is enlarged? So here enlarged. So urine cannot pass because urine get compressed. It is the disease. The name of the disease PHP. Urine already is not coming in that male. So the male is having PHP. So urine is not coming. The male already have trouble in passing urine. So give this anticholic. What is anticholic do? It will release. Never give it in PHP. So in this video we'll discuss the cholinergic drugs. These are the drugs examples. Then mechanism of action. Here first one black enzyme. Here it black only muscarinic receptor, not in nicotinic receptor. Because of that it also prevent that binding of acetylcholine. So it have 6 uses and 2 side effect. Bradycardia, increases heart rate, diarrhea, then relieve the diarrhea, GIT. Then this one urine retention is opposite. So here it will causes urine anuresis. Then in eye mydriasis, in gland excessive nasal secretion, coryza free anesthetic medication we can use in central nervous system motion sickness. Whenever we are traveling, that time it will cause us vomiting that time. Then parkinsonism, then antidote. Contraindication. Thanks for watching.